so glad they sat at their own table. All right, it's a good thing those guys are exercising, because there's good, there's bad. We all have it. What is it? Here to tell you everything you need to know about cholesterol. Welcome, Dr. Michael Grimes. How are you?
Nice
to see you.
Nice to see you. Thanks for having me.
So, what is cholesterol, and why do we need to worry about it?
Well, actually, a lot of people may not realize it's very essential to the body in formation of our cells, our day-to-day living, hormonal production like estrogen, testosterone, progesterone.
Okay.
But it's when the bad, imbalance
which letters are the bad ones and which are the good ones?
The HDL, high-density lipoprotein, is the good cholesterol.
Okay.
And then the bad cholesterol is the LDL, low-density lipoprotein.
Okay.
So when there's an imbalance of those, which we believe the LDL is the bad, again, the bad one that goes out and lays the plaque down within the arteries, compounded by, if you have high triglycerides, which are believed to cause the hardening of the arteries.
Okay.
So when we get that imbalance, then that's when it becomes a problem.
Okay. Well, we'll talk about who's at risk. Is everybody at risk for high cholesterol?
Yes, some more than others. Men over 45, women over 55, and then people with a strong family history are especially at high risk, to the point where researchers are now saying we should start screening even in childhood as early as the age of 6, which is kind of controversial. Yes, because we're seeing now people, when we were younger, you didn't think of someone having a heart attack or stroke till they were in their 50s, 60s, maybe even 70s.
Right.
Now, as I mentioned, those with a family history, I've seen patients as young as in their 20s have massive strokes.
So what's causing this?
Our lifestyles, our diet, as you explained on the earlier segment, diets and high processed foods, white flour that we're using, candy, pop.
Because you always hear, and excuse me for interrupting, but you always hear, back in the day, they ate bacon and eggs, they had sausage gravy and biscuits and all that,
Yes.
Way back,
Yes.
and people didn't have the health problems that they have now.
Well, I think people were much more active then as well. We live today a lot of people live a sedentary lifestyle, high stressed with the way the economy
does stress
is.
have something to do with it?
Major.
How?
Just basically, it makes the arteries constrict, which raises the blood pressure, high blood pressure, diabetes, again, high stressful lifestyles, not moving, being inactive. And then also vitamin deficiencies. We're finding that, one study I read said that people who have a deficiency in vitamin B, some of the Bs, 12, niacin, and I believe folic acid, are at a higher risk of heart attacks and strokes as well.
Really?
Yes.
Okay. So how do we get tested, and who do you recommend get tested?
If you have risk factors like we just mentioned, the high blood pressure and diabetes, they definitely should be tested. Family history, again, anyone, men over 45, women over 55. But in our practice, we're very preventative, so if there's any way we can test, we order it, and hopefully the insurances will cover it.
Yeah, and that scares a lot of people if they think they have to pay for it themselves.
Oh, definitely,
right?
definitely. But there's programs available too for those who don't have insurance.
All right. Now, is it a fasting?
Yes, it is a fasting.
A fasting
you get an
blood
accurate,
test.
Yes.
And then how often do you need to be checked?
Well, if it's under control, I'll usually check a patient once a year. Those who aren't under control, I'm checking as, it just varies depending on the severity and their other risk factors. I may check it every 3 months. If they're on medication, then we're also conventional medication prescriptions, the more common statins like Lipitor, then you're checking the liver enzymes as well to make sure that they're not, being affected by the medication.
And natural remedies would just be staying away from processed foods and exercise and
definitely
like
living a healthier lifestyle, exercising definitely is beneficial. Weight loss will increase the good cholesterol, because sometimes having a low good cholesterol is as bad as having a high bad cholesterol. So weight loss there's no magic pill for increasing the HDL. Exercise works. Niacin is a very effective natural remedy that's been shown to be as effective as some of the statins. So that's a very good one, as long as you get the non-flushing. Stay away from the flushing. It gives you a whole new appreciation.
Flushing.
Yeah, flushing is similar to what I believe women would experience as hot flashes. So.
Yeah. Oh, we don't want that.
Yeah.
We do not want that.
You know.
No.
You want your man to understand what you're going through, then you can slip him a little bit.
Dr. Michael Grimes, thank you so much.
Thank you for having me.
Summa Physicians. And we will be right back right after this. Did you meet my little dog?
Yeah.